Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Pentobarbital. Its brand name is Nembutal. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Pentobarbital. We'll then touch on an example of dosing, and finish it off with side effects with percentages. I put together some slides to go over this information. Let's just jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Pentobarbital is a short-acting barbiturate. It has the ability to decrease motor activity, depress the sensory cortex, interrupt cerebellar function, and promote sedation, hypnosis, and drowsiness. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used as an adjunct for anesthesia. It can be used for short-term treatment of insomnia. It can also be used for sedation or for emergency control of seizures in certain acute convulsive episodes. With respect to contraindications or reasons we would not be able to prescribe Pentobarbital, we wouldn't give this medication to a patient who had a hypersensitivity to barbiturates. As well, we would avoid giving this medication to a patient with a history of manifest or latent porphyria. Porphyria is a group of liver disorders where porphyrins build up in the body and negatively affect skin and the nervous system. Now for an example of dosing with Pentobarbital. So if it's used as an adjunct for anesthesia or for insomnia, the dosing may be the same. So first of all, we want to make sure that the dosage should be individualized based on patient age, weight, and their condition. However, we may see a dose of 150 milligrams to 200 milligrams given intramuscularly as a single injection into a large muscle. No average IV dose is available, but a commonly used dosage for a 70 kilogram adult would be 100 milligrams intravenously initially at a max rate of 50 milligrams per minute. We then may dose up to a cumulative dose of 200 to 500 milligrams. Again, this would be divided up in 1-minute intervals. As with all medications, there are some side effects or adverse reactions that patients may experience while using Pentobarbital, so we'll go over some of those here now. Confusion may happen at a rate of less than 1%, dizziness at a rate of less than 1% as well, somnolence may happen between 1 and 3%, and agitation, again, less than 1% of the time. Some serious side effects may be liver damage, happening less than 1%, Stevens-Johnson syndrome, less than 1%, apnea, or hypoventilation, again, both happening less than 1% of the time. All right, everybody, that's all we're going to talk about today with Pentobarbital or Nembutal. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.